Welcome to Momming as a Millennial, the podcast where we explore the intersection of tradition and modern parenting. Have you ever felt overwhelmed trying to balance being a mom with your professional aspirations, all while dealing with side-eye from your parents who think you're doing it wrong? Me too. I'm your host, Christine Gerizzo, a journalist, blogger, and proud mama of 2 young children. I'm so glad you're here with me. Together, we can navigate the complexities of millennial motherhood and find what resonates with our true, authentic selves. Let's dive in. And we're back with part 2 of our conversation all about hormones. I'm talking to Teneika Gravely. She's a board-certified family nurse practitioner, and she's certified in bioidentical hormone replacement therapy. She founded Tag Family NP to help those who are struggling with weight challenges, hormonal imbalances, and cognitive issues. And we are going to pick up our conversation about hormones. If you missed part 1, you're definitely going to want to go back and listen to it. We talked all about hormones and pregnancy and postpartum and everything that comes along with that. So that was a great conversation. Make sure that you go back and listen, and we're going to dive right into part 2. Thank you for joining us. So the next topic I kind of wanted to get into is about body image, struggling with weight after being pregnant and having children.
Mm-hmm.
And I spoke a little bit about this on the last episode I did. Whenever I've tried to lose weight, I have never really done it in a healthy way.
Mm-hmm.
And I've been calorie counting, or it's been an extreme. But I don't know how to lose weight in a healthy way that's going to stay, you know, because I feel like a lot of the times I yo-yo. And I also opened up quite a bit about my lack of self-confidence. I just don't feel like I've ever had it. And then being a mother just pushes you over the edge. So I would love to hear from you how hormones, of course, impact weight loss after having children and what you can do to help people who are struggling with this problem or not being able to lose weight or not feeling self-confident.
So first, I'll say you definitely have to give yourself grace after having a baby.
It's really hard.
It is.
I mean, I look back, this is a funny story. So after our first, my in-laws took a picture, it was like the 3 of us, and then they put it on an ornament. And my face was puffy. It was literally days after having a baby. And now we have this ornament that goes on my tree every year. And it's so, yes, give yourself grace. But why did they do that? Anyways, I digress.
Oh, no, but that's what I do get new moms who come to me. They're not even past their first 6 weeks. They haven't even been to their follow-up appointment. And they're like, how do I get this weight off? And I'm like, hold on. Your body has just been through one of, like we talked earlier,
trauma.
The most traumatic events it's ever going to go through, right? And you've just done this amazing, incredible thing of literally building a human.
Yeah.
So you kind of got to give your body time to just say, whoo, okay, let's recover from this, 9-month period that we just been through. It will be well, I shouldn't say for everyone, because some women can give birth and they look like they never had a child. And you're like, okay, what planet did you come from?
Yeah.
Like, how did this
That's
happen?
frustrating.
So as far as hormones go, like I talked about earlier, your progesterone, estrogen, cortisol, everything is kind of just out of whack. Everything plummets right after you have the baby. Then everything is trying to get back in balance, right? So you might have some spikes here and there. Let's take cortisol, for example. High cortisol, because your body's trying to get regulated. High cortisol can definitely hinder weight loss. If we move to even things like insulin resistance after having a baby, that's going to hinder weight loss. We move to estrogen dominance because everything's trying to kick back on. So you can have those spikes. That's going to hinder weight loss, and that's going to add weight around that midsection.
Yeah.
So not only do you have this postpartum belly left over, but you have all these other things that's adding on. Thyroid dysregulation, hypothyroidism. is going to slow down your metabolism. Inflammation, your body just went through a lot. So it's going to be some inflammation there.
Mm-hmm.
You're not going to lose weight while you're inflamed. So you definitely have to give yourself time. I do not put anyone on a diet program if they're within a certain period after having a baby. We focus on getting optimized. So your nutrients, making sure you're not anemic, which a lot of women are after they give birth because of the blood loss.
Mm-hmm.
We want to make sure that you're eating properly, still taking those prenatal vitamins, protein, huge. And then when it's okay for you to get back to, exercise and things like that, we want to incorporate strength training. Initially, I just say, go for a walk, put the baby in the stroller, go for a stroll, because all movement is good movement, right? But when you can start that strength and resistance training, that's huge for you. That and protein is going to be a huge help. Then as you transition, time goes on, then we can say, okay, we can now do, more time restricted feedings, or, if someone is more into macros and calorie counting, I usually do what's called the healthy plate with a lot of my patients, because when you put in macros and calorie counting, people are like, I'm not doing that. It's too much work. Or they'll miss a few meals of counting their calories, and then they'll be like, oh, I'll just start over tomorrow.
Yeah.
And then tomorrow comes, and like, oh, I'll just start Sunday.
Yeah. Yep.
So when you do the healthy plate, you just simply divide the plate in half. Half is vegetables. You divide the other half in half, and then that's protein and your healthy carbs. And then you can drizzle your healthy fats over it.
Okay.
So it's simple enough.
Yeah.
It's something that you can always remember.
Yeah.
And also with my programs, I work from the inside out. So your metabolism is getting taken care of from the inside out. We draw, like I said, your labs. We see how your hormones are doing. We see how your nutrient panels are doing. Make sure that you're not anemic. Get everything optimized. And then you're going to start to see that weight automatically come off. So there is a science behind it.
Yeah.
The fat diets will not work. It'll make you frustrated, or you'll lose, but then you'll gain, and then you'll gain more than you were even before you started. And that can become frustrating. And then that just becomes, a circle. Yeah. So,
you said estrogen dominance. What do you mean by that?
So estrogen and progesterone balance each other out.
Are they supposed to be
like
equal?
A seesaw. Yeah. So there's a ratio. So if you're estrogen dominant, you are not going to feel great. You're going to have some pretty crappy symptoms, You can have sore, tender breasts, which you're going to have if we're talking postpartum.
Right.
Kind of comes with the territory.
Yeah.
But you're going to have that weight gain, fatigue. You're just not going to feel like yourself. Women that have estrogen dominance, they'll come to me and they'll say, hey, this is what I'm feeling. When they list those symptoms, I'm like, it's probably what it is. You need progesterone to kind of balance that out. You also have to make sure that you have like healthy liver function and things like that, because that's where a lot of your metabolization goes through. So
I didn't know that.
Yeah. Before I start anyone on hormones, we do either like an elimination diet, or I do a gentle detox with them. We have to get the gut health, in check. I just don't throw you on. You don't come to me and say, oh, I need hormones. We do your labs. And I say, here's your hormones. It's a whole program that comes with it. And then that usually also helps with women who are naturally estrogen dominant. Those who will have heavier cycles, clotty cycles, things like that. So once we get through all the symptoms, when I do your intake, I'm pretty nosy. I ask a lot of questions. Once I read that, I can pretty much gauge like, okay, I think I know what's going on. We always do get labs just to confirm, but you're treated mostly based off your symptoms.
Interesting. I did not know any of that. That's super helpful. So the last thing I wanted to talk about was perimenopause. I've been hearing a lot more about this recently too, especially on social media. And it's funny, I read the first sign of perimenopause is often irregular cycles, which I experience a lot, so it's not very helpful for me. And the other thing, I'm going to be 40 this year, which is crazy. So
fine at 40.
I'm not worried about turning 40. It's just like, wow, that's a number. So should this be on my radar? Like, is this a new concept? I'm very curious. Has there always been perimenopause and then menopause? And like we only knew about menopause before? I've never heard anybody, like my mother, grandmother, I've never heard them talk about perimenopause.
Yeah. So it's not a new term, but it's just never been talked about.
Yeah.
Right?
Like with all women health things.
So with perimenopause, you go through roughly this 10-year span.
Okay.
So perimenopause, let's start here. Menopause happens when you go through 1 full year of no menstrual cycle.
Okay.
By definition, it has to be that 1 year.
So
the
you're
365th day.
You're done releasing eggs.
Yeah.
Is that okay?
Yes. Your ovaries have quit. And I've retired.
Yes.
So when you reach menopause is just 1 day. It's that 365th day. After that, the next day, you're in postmenopause.
Oh. Interesting.
Perimenopause can happen 7 to 10 years before you reach menopause. During perimenopause, what happens is your progesterone, remember that balance we were talking about? So your progesterone start to take this slow decline, right? Your estrogen now is erratic. Before it had this nice cyclical rhythm to it. Now it's just all over the place. This is how you can have those shorter, heavier cycles and definitely irregular. So you may have been, on average, your cycle is every 28 days in a perfect world.
Right.
During perimenopause, it can become longer. And sometimes some women go a few months with no cycle, and then all of a sudden they have a heavy cycle. And they're like, well, how did this happen? What's happening is the signal that comes from your brain. You have a LH and FSH. So your hypothalamus tells your pituitary to tell your ovaries, hey, let's get going, right? Your ovaries are like, no, I don't feel like it. So you go through this period. So your brain is like, okay, we got to turn this up. And it's cranking it up and it's cranking up those signals. And then all of a sudden your ovaries like, plop. Okay, let's give them one. So then now you have this cycle, but it's a heavy cycle because you've had all these signals sent to your ovary. And then this can just become repetitive. You may have your cycle for a few months and then nothing for a few months. And then you're like, oh, I'm almost there. That 11th month coming, you have a cycle. Guess what? You're starting all over again before you can reach that definition of menopause. With perimenopause also comes a slew of symptoms. Anxiety for women who've never been anxious before.
I'd say that's what we need.
For women who've already had anxiety, it worsens.
Oh, geez.
Palpitations. I've had women who've caught me with full-blown panic attacks overnight. Oh, yeah. Women who can't sleep. They have insomnia, foggy brain. I've had women who considered quitting their jobs because they were in high-performing positions and they just didn't trust themselves anymore because they couldn't remember things that they were, used to doing. And they're nervous now. And they're like, oh my gosh, what if I make the wrong decision? You have symptoms like weight gain, right? That's a huge thing for women in perimenopause, especially in the belly. That belly starts growing and you're like, whoa, what's going on here? Some of the least common symptoms that most women aren't aware of is joint pain, frozen shoulder, things like that. So there's definitely a lot of symptoms that can happen. Some women will go through this period and not feel a thing.
Oh, it's like the women who lose weight after pregnancy.
Yeah. Some women go through every symptom that's listed. Yeah. So it's really individualized. I would definitely say that the earlier you tackle it, the better that transition into menopause will be. If your hormones are optimized during perimenopause, you should have expectedly a smooth transition into menopause. Again, everyone is different. Once you reach menopause, if you haven't started bioidentical hormones, research says that you should start it as soon as possible, but within a 10-year period. Because at that time, now your progesterone and estrogen receptors have blunted and you won't get the effect, the positive benefits from the hormones. when you are in menopause, the things that you have to worry about now, because some of your symptoms are going to start to resolve. Those perimenopause symptoms are starting to resolve. So now the things you have to worry about is cardiovascular health, having a heart attack, because estrogen is heart protective, Alzheimer's, dementia, and osteoporosis because of that drop in estrogen. Now your bone health is at risk. So that same fall you would have had 10, 15 years ago and got up, with just a sore hip, now you have a hip fracture. So those are things that also need to be considered in that period.
Huh. Yeah, that's interesting. You mentioned about the estrogen fluctuating, and that's where that belly fat comes from. And I know that's the hardest thing for women to lose. And so just optimizing your hormones could help with that?
Optimizing hormones, but it's not just optimizing hormones. Everything works together, right? So you have to optimize not only your sex hormones, because when you say hormones, people automatically think estrogen, progesterone, testosterone. They forget about cortisol. They forget about insulin. They forget about thyroid.
Yeah.
There's, I think, 21 metabolic hormones that can affect your weight. I actually have a video on it on my Instagram page where I'm showing all the hormones that affect you metabolically. So, you definitely want to optimize your sex hormones, but you also want to optimize the other hormones that I mentioned, and you want to tackle inflammation because you're not going to lose weight if you're inflamed.
Yeah. So what you're describing as perimenopause is like what my mom told me menopause was. So hot flashes, does that fall into perimenopause
Both.
only? Oh, okay.
Yeah.
So
your symptoms don't stop just because you reached
reached
menopause.
Okay.
It doesn't say, oh, we're in menopause, we're done. Good job. What happens is when you reach menopause, you're still going to have these symptoms. In a perfect world, these symptoms will start to resolve.
Yeah.
If you're on bioidentical hormones, then you shouldn't really be experiencing, if you're optimized and treated properly. The goal is to resolve these symptoms. Some women, they still may experience some symptoms, but it's tolerable. We really want you to get back to the way you were feeling before. That's the ultimate goal. And that can happen in several ways. I do everything as a whole. I don't just focus on hormones. Like I said, we're going to incorporate gut health. We're going to incorporate lifestyle, sleep, stress, nutrients, even things like endocrine disruptors, things that are in our homes that we're exposed to that's going to alter our hormones, cleaning products, microwaves, plastics, things like that, our food containers, things we drink water out of. All those things need to be taken into consideration. Now, am I expecting you to go home and throw everything away? No. But you're aware and you'll make better choices going forward.
Right.
You'll especially make better choices for your children because you'll say, oh my gosh, I've been drinking out of Solo cups and styrofoam plates for years. I'm not going to do this for my kid. We're going to, drink out of glassware or stainless steel and eat from a real plate.
Yeah.
So that's just the education that we want to get out there. Not saying it's too late for us, but we can definitely make it better for our children, and we can properly educate them so that they'll have a better experience than we had.
So I have a couple more questions based off of what you had just been saying. So I feel like my mom had hot flashes for like 20 years. So is the severity of perimenopause and menopause genetic?
It could be.
So there's not a lot of hope for me.
There is hope because you can have hormone replacement. But usually they'll say, for example, if your mom went through early menopause, 9 times out of 10, you're going to go through early menopause.
Okay.
If she went through menopause late, you'll probably go through late. But then there's other things that you need to consider. If you're a smoker, you're going to go through menopause earlier. If you've had a hysterectomy, you're going to go through menopause earlier, and if you have a hysterectomy where they remove your uterus, but your ovaries are there, research shows that you can go through menopause at least about 2 to 3 years earlier. Obviously, there's surgical menopause where your ovaries and your uterus is taken. You're automatically into menopause no matter what age you're in. So there are outside contributing factors that can alter that genetic timeline.
Right. What about severity?
Severity, that's more individualized. If it was severe for your mom, it probably will be severe for you. But again, are you leading a healthier lifestyle than your mom? Are you eating better? Are you more optimized, nutrient-wise, less stress? You're sleeping better. So those things are all contributing factors.
Okay.
But I would say if you two side by side walk the same line, technically you could experience the same symptoms that she experienced.
Interesting. Well, that's encouraging and discouraging at the same time, I will say. So the bioidentical hormones, can you talk a little bit about that?
Yeah.
That the same as hormone replacement you mentioned?
Yeah. So hormone replacement therapy with bioidentical hormones, those are hormones made from a compounding pharmacy. They're made from yams or soy. They have the same molecular structure as the hormones that we have.
Okay.
Synthetic hormones are made from chemicals. Oral birth control is made from pregnant mares, so pregnant horses. We're using their estrogen.
Oh.
So there's some research that shows that bioidentical hormones are safer for you as far as, you don't have that risk of blood clots.
Like the other two?
Right.
Okay.
Right. So I look at that and I also determine who I'm treating, right? There's different forms of hormone replacement therapy. So there's transdermal, which is on the skin.
Okay.
So you can get a patch form, you can get cream. In the creams, you can mix things together, your estrogen, progesterone, testosterone. And there's another one called DHEA. Then there's oral. You could do that with progesterone or estrogen. And there's injection. So with the route of administration, usually creams, transdermal, which is the patch, and the injections are all fairly safe. Some research shows that there's a higher risk for blood clots when you take the oral form of estrogen.
Okay.
And that's because when we talked about the liver, it's metabolized through the liver. The liver produces coagulants,
Yeah,
and
makes sense.
that technically can increase the risk for blood clots. Now, with synthetic hormones, yes. With bioidentical hormones, you'll have some providers that say, nope, absolutely not. You'll have some providers that say, yes, it can. And it just all depends on what research paper you're reading.
Yeah.
So you kind of have to look at it in the sense of who you're treating. Now, I won't treat anyone with hormones who are excessive drinkers, substance abuse users, or smokers, because those all increase your risk for, cardiovascular issues and things like that. So we have to strike those off the table. It also depends on, do you have non-alcoholic fatty liver disease? Do you have cirrhosis of the liver? So different things will help determine which route we're going to treat you with.
Yeah. Do you ever use the chemical?
No.
Okay. Yeah, I didn't think that. I was just gonna... That's what I was kind of picking up.
No.
So that makes me think of birth control because, you mentioned it. I was on birth control for almost 20 years, like a low estrogen pill. Does that influence any? Like after I had my first child, I went back on it briefly because we were going to wait to have the second. And I felt awful. Like I almost felt like I was going through puberty. Like it was a very weird, like I had so much acne and I just felt like moody and stuff I've never felt with before. So I immediately went off and I said, no, we're just not going to do that anymore. But I'm just wondering what being on it so long, does that impact anything with perimenopause, menopause, hormones?
So some GYNs will put you on oral birth control pills, and not necessarily bioidentical hormones, but the synthetic oral birth control pills to control some of the perimenopause symptoms. They'll put you on it if you have like irregular cycles and you're just complaining,
Mhm.
oh, I can't take it. The cycles are irregular. I'm feeling all these symptoms. Then they'll put you on the oral birth control pill. As far as it impacting, there is some research that shows that it can prolong menopause, if you're going or reaching menopause.
Mhm. Yep.
So it depends on how long you were on the birth control pill for, but that's pretty much the only actual effect it'll have towards that,
Gotcha.
perimenopause, menopause phase. But there are some providers who definitely will put you on that to help control those symptoms. But bioidentical hormones are better.
Yeah, I was going to say, and again, looking holistically
Mhm.
at
Mhm.
the patient. No, that makes sense.
And again, you don't just want to be thrown on hormones,
Right.
right? So how you said you just felt off.
Yeah, it was bizarre.
Right. And that's because other things probably weren't balanced.
Mhm.
There's definitely other things that we have to look at when we're going through that phase. And if those things aren't addressed and they're band-aiding you with this synthetic hormone, you're probably going to feel like crap. So,
Yeah, and it's just weird to think that it's from a horse.
yeah.
Horse estrogen.
People are like, what?
I don't know why no one ever told me that. I don't know how I feel about that. I was taking it all those years. All right. That is all the questions that I had to pepper you with. So is there anything you'd like to add before we wrap up?
Just definitely get educated, advocate for yourself, give yourself grace. We're going through a lot. A lot of women, again, are ignored. Don't accept that. Find a new provider if you feel like your symptoms aren't being addressed. You're not crazy. You're not just tired. You're not depressed or anxious, and don't let them just throw you on a prescription medication and send you out the door. Yeah. Definitely find someone who is going to take the time, listen to you, find out what your symptoms are, and address those symptoms. Because you deserve it. And no one deserves to live their life crappy. I always tell people, women, we technically outlive men by 7 years. But those 7 years, they're hell.
Yeah.
They're, we're going through so much medically that it's like, well, is it even worth?
Right.
No, let's make the best of it. Let's get you optimized. We're not saying that it's a fountain of youth.
Right.
And you're not going to age, but we just want you to have the best possible life and feel the best you can while you're here. And that's the goal.
I love that so much. Yeah. When I was originally talking to Teneika about this episode and, the topics we were going to talk about, she mentioned how her passion is education. I think that came through very clear today. She just wants to help people with no background or understanding to really know what's going on in our bodies. And I think I'm going to go back and listen to this because that was a lot of information, but you provided so much education today. And I'm so grateful that you are so passionate about this and you were able to come on and really, share this knowledge with all of our millennial mamas out there so that you could have what you need to live a healthy life, just like what you're saying. And I think that's amazing. So thank you for joining me today.
Thank you for having me here.
I appreciate it.
I enjoyed it.
If you have any questions for Teneika or would like to get in touch with her, I'm going to put all her information in the episode show notes, or you can visit tagfamilynp.com. And thank you all for listening. Until next time.
Bye.
Bye. Thanks for tuning in to Momming as a Millennial. If you enjoyed the episode, please share it with a friend or on social. You can find more from me at contemplativemama.com. Until next time.